friends, welcome back on today's Women Health series, Tonya and her midwife, episode 2. Make sure you listen and learn something because I am going to bombard my midwife with a lot of questions. I have plenty of questions and I hope she doesn't run away from me. Midwife Mark, I hope you're ready for me. I am sorry. It's fine. Because of time, I will just be answering 4 questions because I don't want this video to be too long. Okay, that's alright. You know, the last time we spoke about vaginal dryness as one of the causes of pain during sweating activities. So, what actually is the cause of this vaginal dryness? Vaginal dryness is caused by a reduction in the level of estrogen. So, this estrogen is a hormone in the woman's body that helps to promote natural lubrication, and then it helps to keep the vagina moist, thick, and elastic. So when there is a reduction in this estrogen, they tend to thin out the vaginal wall and makes it dry. So now, what is the cause of this reduction in estrogen? The first one is menopause. That is the major cause of reduction in estrogen, menopause. So during menopause, some of these hormones tend to reduce in level and in quantity. The production tends to reduce. Another one is breastfeeding. When a woman is breastfeeding, the hormone that acts during that breastfeeding period is the prolactin that helps to produce the milk. You understand? So with the high prolactin, it suppresses the production of estrogen. So that one is another thing. Other causes can be hormonal birth control pills, some medications like the antihistamine and antidepressants. And then we can also talk about lifestyle factors that affect our hormonal imbalance, like touching. In the vagina is self-cleansing. You don't have to wash the vagina. You don't have to use harsh products to wash the vagina. It also causes hormonal imbalance. Alcohol and smoking also reduces your level of estrogen. So if you're smoking, you have to stop. Vaginal dryness can also result from lack of foreplay and probably irritation, or probably condom irritation. So this is why vaginal dryness. Okay, that's fine. Thank you. So the second one is, I notice that whenever I cough or sneeze or maybe do small exercises, I usually leak down below. I don't know what the cause is. Forget that I'm laughing. No, I am really worried about that. Forget that I'm laughing, please. I understand you. Now the thing is, when you cough or sneeze, you apply force or pressure to the abdominal wall and it pushes it down to the bladder. Now the bladder will pull it down to your pelvic muscles. When your pelvic muscles are weak, they cannot withstand all these forces and then you leak. So it's more like as a result of weakened pelvic floor muscles. So what are the causes of weakness in the pelvic floor muscles? It is due to change in the pelvic floor muscles that mostly happens after delivery, or maybe you went for a pelvic surgery, or even menopause, or even bladder infection. So all these things are due to change in the pelvic floor muscles, probably because of weakened pelvic floor muscles. And you can also get it when you normally lift heavy machines or heavy equipment. It can still happen. It can weaken your pelvic floor muscles. So you have to go to the doctor and get examined. They will know the exact cause of this weakness. You didn't deliver, you're not a postpartum mom, so that one is ruled out. You're not also in menopause, that one is ruled out. So you can check other causes that I mentioned. In most cases, they usually give you pelvic floor exercises to do, and after you do that, it can resolve. So you can even try doing the pelvic floor exercises, the Kegel exercise and all of that. You can try to do it and see if it resolves. If it doesn't, you go and see your doctor. They will refer you to either physiotherapy or just give you the exercise to do. Okay? And the third one is, I usually see bump like acne around my vagina area. Sometimes it's red and it's inflamed. You understand? I asked Google and Google said I have STI. Hey, God, I beg. Midwife man, do I have STI? Does it mean I have STI? Ma? Are you trying to judge me? No, not of course. We listen, we don't judge. I'm just calling your name. So tell me, do I have STI? If there is only one thing you take home today, let it be that you don't rely on Google for your diagnosis. There is what we call differential diagnosis, and it's only trained healthcare professionals that have the ability or the science to differentiate one condition from the other. Okay, so it's actually good you're asking me this today. I will advise you, avoid Google. Stop asking Google to give you diagnosis of whatever symptoms you're having, because they will give you loads of things. Like you will see a lot of things in Google, and you start panicking, you start being depressed because you think you're having what you're not even having. Now, before you think of STI, remember the fact that this place is always kept moist, covered with tight clothing, and no fresh air at all. And this environment makes bacteria, like it gives bacteria the opportunity to thrive. You understand? And it tends to cause the redness, the acne, the bump, the inflammation you're talking about.
Because
And
I
plus,
wonder,
whenever you shave, most times the irritated hair follicles causes this issue as well. I'm not ruling out the possibility that it could be an STI. Wait though, I'm not saying you have STI, but I'm not ruling out the possibility that it could be an STI. But first of all, learn to keep this place dry. Learn to avoid tight clothing, especially when you are at home. When you're sleeping, learn to remove all clothing, especially down below. You need to leave it free, okay? And whenever you shave in direction of the hair. If the hair is going down this way, you shave in direction of the hair growth and not opposite, because it can cause this irritation that might lead to bumps and all of that. So when you are sure that you've done all these things and you still have persistent bumps, redness, and acne, you have to go to the doctor so that the doctor will rule out STI. If they are sure that it's not STI, they can find other ways to treat you, maybe to give you antibiotics for all other stuff, or maybe cream to apply on there, and maybe other measures that you can take to stop this development or these issues.
Thank you.
Does it make sense?
I think I'm a bit relieved now, to be honest. I am.
Please, you will stop using Google to give yourself headache and depression. I beg. And finally, the fourth one. Why do I have to have painful menstruation? Like, why? I'm tired. I know, right? You see, my pain is actually normal. It's as a result of prostaglandin. This is a hormone, like chemicals, that is being released during menstruation. And this hormone helps to contract the uterus to shed its lining. So when this uterus is contracting, it temporarily restricts blood and oxygen to the muscles, and hence the pain. Like, it's a normal thing, it's a normal phenomenon that has to happen. It's just that some people has low level of prostaglandin, and others have high level of prostaglandin. That is why the pain.
I seriously want
is
to be
fine.
those people that have low prostaglandins, because
My sister, if you don't have pain during menstrual cycle, you don't know what God did for you.
I know, right?
So, however, if this pain is stopping you from doing your activities of daily living, from going to work, from going to school, from concentrating, it doesn't really give you time. It can come and go, that's fine. But if it doesn't give you time at all, you need to go get checked, because there might be an underlying illness that is not just menstruation. Okay? You need to go get checked. I know, we are women. That is what we have to suffer. Stop
like,
share, comment, and follow.
See you
for
next
more.
time.
Bye.